Have you ever been told, "Oh, you're bone on bone. You've got the worst. I'm surprised. Your worst knees you've ever seen. You should stop squatting." My name is Dr. Aaron LeBauer with LeBauer Physical Therapy,
And I'm Dr. Nielsen with Kaizen Physical Therapy.
and we're here to talk to you today about knee pain and arthritis. It's one of the most common reasons that keeps people as they get older from staying active, and we see it all the time in the clinic. And yes, sometimes when you have knee arthritis, you need knee surgery. But there's a lot of things you can try before then. And just because someone tells you you're bone on bone, it's no cause for alarm. Because we see people all the time who have some torn cartilage and some arthritis in their knees, and they're still squatting, they're still running, walking as much as they want, and doing the things that they'd rather be doing than sitting on the couch going, I can't do anything because I'm bone on bone.
Yeah, this is literally the most common diagnosis we see is arthritis. It's one of those diagnoses that it's not a matter of if you're going to get it, it's a matter of when. And in fact, they've shown in multiple studies that people in their 20s have arthritis. So the bone-on-bone diagnosis, yes, like Dr. LeBauer said, it can be the cause of pain, but typically it's not. It's not the cause of pain. It's usually, an upset muscle somewhere around the knee, or the hip's not moving like it should, or acting like it should, or there's some sort of stability dysfunction that your body's just not participating and acting the way it should. So then you start having some knee pain.
When you have arthritis, it's contrary to popular belief, the best thing to do when you have arthritis is to move and use the joint. Because what that does is that triggers synovial fluid, which is the fluid in your joint, to be produced, and it lubricates the joint and allows it to move. Most people's initial reaction is, oh, I've got arthritis, I've got to sit still, I can't do anything, I can't move it, don't use it. It may be a little uncomfortable, but it's not going to harm you to move and use your body and walk the way it was meant to be used. So the thing with arthritis is, like Dr. Nielsen said, everyone is going to have it. It's kind of like wrinkles, It's part of wrinkles on the inside. We get older. We have more arthritis. We have more wrinkles on our skin. And you can deadlift hundreds of pounds when you're 85 years old. You can run a marathon. You can, squat 1,000 times, 100 pounds. You can do CrossFit. You can do yoga. You can play golf all day long. You want to improve your golf game? We have to help your back, your spine, your hips move better. What happens when people get arthritis? They say, oh, I can't move, and then their golf swing becomes really stiff. So if you've been told you are bone on bone, don't worry. If you would rather be doing something else, you want to be active, healthy, and mobile, then that's where we come in.
And this is, again, this is one of the most common diagnoses we see. And a lot of times, I don't know about you, but a lot of times patients will get a steroid injection.
Right.
And, sometimes those will help and sometimes they don't. But, what happens, regardless of if they help or not, the pain is going to come back at some point if we don't change how the body is acting. All that the steroid injection is masking the pain. That's all it's doing.
Right. And if you get a steroid injection and it doesn't work, you know what? That said that the inflammation wasn't the cause of the pain. If it does work, then great. Now we need to see you because now it can move better, more freely, and we can really get down to the cause of the problem and help your body feel like it can move your knee or your body without alarm, without the alarms going off, without causing more pain and symptoms.
Because the big difference between us and an x-ray or an MRI that shows just bone on bone or arthritis is we look at movement. We know how the body is supposed to move from your neck all the way down to your ankles. And when we see something that's not moving the way it should, we need to correct that. And then usually the pain disappears regardless of the diagnosis.
Right. For instance, you may have an ankle problem that you didn't even know existed. Same thing happened to me. I had knee pain, and I knew I didn't have a problem with that knee. I just stopped this certain movement. A few months later, I was at a course, and the person leading the course was like, what's wrong with your ankle? And I was like, what do you mean what's wrong with my ankle? Ankle was contributing to some knee pain that I had experienced, and that happens to our patients a lot too. They have knee pain, we take an x-ray of the knee, oh, there's arthritis, arthritis is the cause. You know what? I've seen patients with knee arthritis diagnoses, the knee moves great, their ankles don't. We get the ankles moving better, knee feels a whole lot better. Vice versa, it might be a hip problem that's causing your knee. Your knee is reliant upon your ankles and your hips, and a lot of times the knee is just the thing that's calling out for help when your body needs help. So if someone is only focusing on your knee, they haven't looked at your ankles, feet, toes, hips, back, shoulders, head, neck, then you are absolutely entitled to another opinion, and I would recommend you coming in to see a specialist like us who can look at your whole body and help you move better. So what should people do next if they're interested in getting some information?
Yeah, go ahead and look for the link around this video, and you can jump on the phone with myself or Dr. LeBauer and tell us a little bit more about what's going on. You can tell us about your past medical history, what makes your knee pain better, what makes it worse, what you've been through, so that we can start to develop a story and see what's going to be the best next step for you. Even though that may not be with us, we can help you go in the next best step that is going to be the most beneficial for you going forward.
And remember, you are not your diagnosis. We look forward to speaking with you soon and helping you continue to be active, healthy, and mobile until the end of your days.